Good morning. Today, we are going to present our thesis entitled Challenges and Coping Strategies of Rural Health Midwives in the Delivery of Family Planning Services in Selected Communities in Indang, Cavite during the pandemic. The researchers are Gingerine De Velas, Giselle C. Castino, Rose Ann de la Cruz, and Jessa Oporquedo. Introduction. Family Planning Service is a vital DOH program that addresses the reproductive needs of the people in the reproductive age. It aims to regulate the population growth of a country, providing health needs of men and women in their reproductive years, ensuring that all the aspects of the members of the family are well taken care of. DOH 2020. The World Health System had been disrupted due to the pandemic caused by COVID-19 virus. The shift of health management, giving priority to the casualty of virus-stricken COVID-19 and setting aside the programs of health, brought not only confusion but fear and disillusion to the people who are needing the services of our health facility. RTI International 2021. The Philippines' entire health system is under tremendous strain, not just to provide COVID 19 patients with health care, but to proceed with other vital services such as immunization, prenatal, postnatal care, and family planning. Mendoza and Ombao, 2020. Given the value of family planning and reproductive health services, policies need to allow service continuity and promote access. Significant system-wide strategies to be followed now include improving the sharing of duties between cadres of health staff, taking care to pay attention to the important role played by pharmacies and drug shops in increasing access to services. The World Health Organization, WHO 2020, has sponsored the widening of the variety of roles that healthcare cadres such as community health workers, midwives, and pharmacy workers will perform. The rapid survey carried out on March 31, 2020 with family planning coordinators and staff of rural health and city health centers, public hospitals, and provincial and city health offices from 29 provincial and city health offices, 175 health centers, and 57 public hospitals in the country revealed that the common challenges faced by our public health workers during COVID-19 include limited staff because health facilities are exceeding their usual operating hours while having less staff report for duty, limited mobility of clients and providers because most areas of the country are under quarantine, stockouts of family planning commodities or supplies, and problems with social distancing and safety.
Statement of the problem. This study examined the challenges and coping strategies of rural health midwives in the delivery of family planning service to the community in Indang, Cavite. Specifically, this sought answer to the following research question. What is the profile of the rural health midwife in Indang, Cavite in terms of age, sex, marital status, education, length of midwifery practice, and number of years working as midwife in Indang Rural Health Unit? 2. What are the challenges encountered by the participant in the delivery of family planning services to the community in Indang, Cavite during COVID-19 pandemic? 3. What coping strategies are commonly utilized by the participants to address the challenges they encountered? Objective of the study. This study determines the challenges encountered and coping strategies employed by rural health midwives in the delivery of family planning services to the communities in Indang, Cavite. Specifically, this aimed to describe the profile of the rural health midwives in Indang, Cavite in terms of age, sex, marital status, education, length of midwifery practice, and number of years working in midwifery in Indang Rural Health Unit. Identify the challenges encountered by the participants in the delivery of family planning services to the communities in Indang, Cavite during COVID-19 pandemic and determine the coping strategies commonly utilized by the participant to address the challenges they encountered. Conceptual framework. This study is designed to examine the challenges and coping strategies of rural health midwives in the delivery of family planning services to the communities in Indang, Cavite. The conceptual framework of the current study is translated into input process output model shown in figure 1. The framework is divided into three boxes: input, process, and output. In the conceptual framework, the input that will be considered in this study are the challenges encountered in the delivery of family planning services to the communities during COVID-19 pandemic and the coping strategies utilized to address the challenges encountered. The process refers to the procedures that will be applied to achieve the output of the study. This will employ a descriptive qualitative research design which involve online interviews with individual participants with the aid of interview guide, thematic analysis of data. The output or ultimate goal of this study is to propose programs that will help rural health midwives implement positive coping strategies in addressing the challenges they encountered in the delivery of family planning services to the communities during COVID-19 pandemic.
Significance of the study. The findings of the study are expected to contribute to the advancement of knowledge on the challenges faced by one group of our healthcare providers in the delivery of family planning services during the period of COVID-19 pandemic. It would also seek to recommend solutions and strategies to the challenges encountered by rural health midwives. This study hopes to make this significant contribution to the following. Field of midwifery. This study will provide valuable information in the field of midwifery on the challenges and coping strategies of midwives in the delivery of family planning services to the rural communities during COVID-19 pandemic. This information can be used to enhance our knowledge and understanding of the current situation of midwives working in the communities that can be used for future practice in the field of midwifery. Midwives. Midwives, particularly those working in the communities, could use the information found in this study. Specifically, the challenges they may face in delivering family planning services to the communities during this pandemic so that they can be prepared to deal with these challenges. Also, the recommendation found in this study can be used by rural health midwives to address the challenges they encountered. Researchers, this study would serve as a motivation to other researchers to conduct more studies related to the topic. This may also serve as valuable reference for future studies among healthcare workers faced with the challenges of delivering health services to the community. Department of Health. This study could be used by DOH to develop programs and policies that will support and ensure the rural health midwives' physical and psychological health and well-being while delivering family planning services to the communities during COVID-19. Assumptions of the study. The researcher is not looking for a cause and effect relationship but rather explores how an individual or group experiences a particular phenomenon or creates meaning. The researcher looks at what people are experiencing, how they are experiencing it, and how they are constructing or coping their reality. By Mariano and Talbot, 1995. These studies focus on the meaning that the participants attach to their actual experiences on challenges and coping strategies in the delivery of family planning services during the pandemic. Its main goal is to explore the phenomenon as viewed by the participants. The rural health midwives were not treated as subjects or persons under authority but as participants who were considered as equal partners in this study. We, as the researcher, have no control over them. The participants were similarly encouraged to share their experiences relevant to the topic inquiry as far as their willingness will allow.
Time and place of study. The local of the study will be in Indang Rural Health Units, utilizing the rural health midwives as the participants. The study will be conducted from April 2, 2022. Scope and limitation of the study. This study will examine the challenges and coping strategies of rural health midwives in the delivery of family planning services to the communities in Indang, Cavite during COVID-19 pandemic. Participants of the study will involve 7 rural health midwives employed in Indang Rural Health Unit. This is a descriptive qualitative research we will make use of online interviews with the participants with the aid of interview guide.
Review of related literature. The Philippine Family Planning Program The preceding discussion are excerpts from Philippine Department of Health, Family Planning Competency-Based Training Basic Course Handbook for Service Providers, 2012. The family planning program has been implemented for 38 years, which started from a demographic perspective to a health intervention-oriented program. In the year 1970 to 1985, PFPP started as a family planning service delivery component to achieve fertility reduction by a contraceptive-oriented approach. From 1986 to 1993, the program was reoriented from mere fertility reduction to a health intervention by improving the health of women and children. From 1994 to 1999, the family planning program underwent another shift that emphasized integration with other RH programs, giving importance to recognizing choice and rights of family planning users. This shift was in the line with the country's commitments made in the International Conference of Population and Development, held in Cairo in 1994, and the Fourth World Conference on Women, held in Beijing in 1995. During this period, the Philippines has adopted and developed a policy framework in reproductive health with the goal of providing universal access to RH services with family planning as a flagship program. Implicit in the policy is the right of men and women to be informed and to have access to safe, effective, affordable, and acceptable family planning methods of their choice, including the right to access appropriate healthcare services that will enable women to go safely through pregnancy and childbirth, and provide couples the freedom to decide if, when, and how often to do so. The vision of the family planning program is to empower women and men to live healthy, productive, and fulfilling lives with the right to achieve their desired family size through quality, medically sound, and legally permissible family planning methods. Its goal is to provide universal access to family planning information and services whenever and wherever these are needed.
Research design. This is a descriptive research design utilizing qualitative methodology to address the research question raised in this study. Qualitative descriptive study is used in qualitative research for studies which are descriptive in nature, particularly for examining healthcare and nursing related phenomena. Data collection of qualitative description studies generally focus on discovering the nature of the specific event under study. Research design. Those data collection involve minimal to moderate structured, open-ended individual or focus group interviews. In this study, the researchers examined the challenges and coping strategies of midwife based on the perspective of the participants. The qualitative approach was implemented by interviewing the midwives of Indang RHU with regards to the challenges they encountered in the delivery of family planning services to the community during COVID-19 pandemic and coping strategies they employed to address these challenges. This was done with the aid of interview guide. Population and sampling. Purposive sampling technique is where the researchers choose to examine the entire population, example the total population, that have a particular set of characteristics, in this case, rural health midwives involved in the delivery of family planning services to the communities in Indang Cavite. Based on the record of IRHU, a total of 7 rural health midwives were employed at IRHU in 2021. Participants. The participants of the study were 7 rural health midwives involved in the delivery of family planning services to the communities in Indang, Cavite. Based on the records of Indang Rural Health Units, they were permanently employed by IRHU. Data gathering. The first stage in data gathering was to seek permission from the Municipal Health Office of Indang Rural Health Unit to allow their midwives to participate in this study. Upon approval, a written informed consent through Google form was sent to the requested participants. Once signed, the interviews with the participant were scheduled based on a pre-arranged and mutually agreed date and time of interview. The online interviews will be done via Google Meet. Interviews were semi-structured using interview guide providing a loose structure within which to explore the topics of interest. The interviews involve an informal interactive process and utilize open-ended questions and comments to gather stories rich, deep description, and first-hand experience. The interviews were recorded to ensure that the interview response accurately captured the live experiences of the participants and the full meaning was extracted from the transcribed text. Participants were interviewed individually.
Research instrument. An interview guide shown in Appendix 2 was used in the conduct of online face-to-face interviews with the participants. The interview guide is divided into three parts. Part 1 contained the introductory protocol that the interviewees researchers followed in the conduct of interviews. Part 2 asked the participants about some background information about themselves. Part 3 were the main interview consisting of open-ended questions related to the challenges they encountered in the delivery of family planning services to the communities and the coping strategies that the participants utilized to address the challenges they identified. Ethical consideration. After the preparation of this research study and upon complying with the research protocol with the panel approval, the researchers sought full ethical approval from the CAPSU Ethics Review Board. Upon approval, all participants were provided with written informed consent. Ethical considerations. The informed consent explained the nature of the study, its duration, seeking the voluntary participation of the respondents, with special concern to their anonymity, data privacy, and the right to discontinue their participation on their discretion. The informed consent also asked participants permission to record the interviews, which were subsequently anonymized and transcribed. Recorded interviews were stored on a password-protected computer which housed all interview data. The output of the study was shared to the participants upon their request. Data analysis. The results from the qualitative interviews with the participating midwives addressed the challenges they encountered in the delivery of family planning services during the period of COVID-19 pandemic. In order to analyze the qualitative interviews, a thematic analysis was used. Initially, the researchers, with the assistance of the research advisor, organized and prepared the interview data for analysis, which involves typing up the field notes and transcribing the interviews. This required the transcription of interview recordings and followed coding stages. The researchers read and reread transcript in order to identify potential themes. The second level of analysis involved reviewing these initial codes. The research questioned about the challenges and coping strategies of the participants in the delivery of family planning services to the community formed this process. At the third stage, analysis was conducted by the researchers to identify codes that are congruent with the overarching themes. Data analysis. Next, the researchers reviewed the themes prior to defining and naming them. Finally, once themes were finalized, the write-up of the final research began. Interpretation and discussion were conducted based on the results of the analysis, which highlighted the findings concerning the major research questions raised in this study.
Results and discussion. This chapter exhibited the research findings of the data collected from the interviews conducted, which were supplemented by a valid interview guide. The findings were presented in relation to the research objectives stated in the study. This section discusses and analyzes the results of the in-depth interviews conducted with 7 rural health midwives in Indang, Cavite. The discussion and interpretation of the findings follows the research questions raised in the study. Themes and tables were created and data were interpreted to understand, analyze, and summarize the verbalized in-depth experiences of rural health midwives in the middle of the pandemic. A qualitative research design was utilized to know the experiences, struggles, and coping strategies of rural health midwives, and each case was narrated one at a time and comprehensively analyzed. Additionally, a concept map depicting the in-depth experiences of the participants in terms of the main objectives, experiences, struggles, and coping strategies with the corresponding themes and categories is illustrated below. Okay, so we have here our concept map. Our thesis title is about the challenges and coping strategies of rural health midwives in the delivery of family planning in selected communities in Indang Cavite during pandemic. So first, we asked our participants what are the challenges encountered, and we have here the 12 themes extracted from the data gathered. And one of the challenges is first, the fear of infection. Second is the staffing and workload. Third is the mobility and transportation, the FB commodities, social distancing and safety protocols, the discrimination from the community, and the conflict with peers and supervisors. We also asked our participants what are their coping strategies during the pandemic. So first, we have the emotion-focused copying, the spiritual retreat, the self-preservation and optimism. And third, what are their ways of addressing or solving the challenges? First, they have the healthy relationship with the patient. Second, we have the proper or careful planning. So from those 12 themes we have extracted, we will now discuss each theme. First, we have here the theme 1, which is the fear of infection. So participants were asked about the major challenges they have encountered in the delivery of family planning services in the communities in Indang during COVID-19 pandemic. So the first challenge they have discussed is about the fear of infection. So the responses of the participants were consistent with the findings of the survey conducted by us, which reported that majority of the participants have fear of infection, which resulted in constant fear that they will carry the COVID-19 to their families and community. Okay, so next we have the team 2, the staffing and workload. So in a total of 7 participants, we have here 1, 2, 3, 4, 5, 6 who claim that limited workforce is one of the major challenges they encountered during pandemic. Since it is a virus they are dealing with, they are left with no choice but to adhere with what is in front of them. And after a one-on-one interview with the 7 participants, they experienced a heavy workload and pressure during pandemic. Next, we have the team 3, mobility and transportation. Participants elaborated that they had problems with mobility and transportation to facilitate the continuity of family planning services, the Indang RHU, and in reaching out to clients. Majority of our participants, which is 7, have elaborated that one of the challenges they encountered in terms of mobility and transportation is the cost of trips going back and forth to the RHU. They highlighted that since the start of pandemic and lockdown, the cost of transportation multiplied by 3 times, which urged them to stay for weeks in the Indang RHU. They also stated they have limited time at home, which caused by the challenges in mobility and transportation. They also stated that they are limited to render service in the communities due to inadequate mobile for transportation. Next, we have here our team 4, the FP commodities. Aside from making efforts to reach to the communities, one of the challenges they also encountered is the shortage of necessary commodities. The supplies ran out of stock during pandemic because of problems with logistics, since most transportation were not allowed to pass due to strict transport protocols. According to 1, 2, 3, 4, 5, 6, 7 participants, they mentioned that it's one of the common challenges they daily face during the pandemic. Majority of their clients are indigent or is unable to purchase contraceptives outside. So most of the time they are left with no choice but to tell the clients to purchase a specific contraceptives since they run out of stock, especially syringes and alcohol swab, which they also included upon purchase. Next, we have the team 5, the social distancing and safety protocols. So with regards with social distancing and protocols, the participants stated that they are following the standard safety protocols by the DOH and IATF. However, despite strict compliance with health and safety protocols, they are still susceptible to COVID-19 because some of them are directly attending to COVID-19 patients at Indang RHU. So we have here 1, 2, 3, 4, 5, 6, 7 participants. Majority of them, of course, stated that they have limited number of consultation and family planning to cater the needs of COVID-19 patients. So they also stated that installing physical and transparent plastic barriers is the way of practicing safety protocols in compliance of the mandated protocol by the IATF. They also stated the practice usage of disposable PPE to prevent contracting COVID-19 and also cleaning the premises is their way of practicing sanitation as safety protocol. Okay, so next we have the team 6, discrimination from community. Participants disclosed that they experience discrimination from community and common discriminatory behaviors that they encountered was related to riding a public transport. So we have 1, 2, 3, and 4 participants revealed that there are times that they were asked not to ride with other passengers in a public transportation. So they also revealed that they are once discriminated by the public because of the news that one of them contracted the COVID-19. The public have fear of visiting the Indang RHU in the fear of contracting the COVID-19. Next, we have the team 7 with conflict with peers and supervisors. So 1, 2, 3 participants mentioned that they are encounter conflict with peers and supervisors as challenges during the pandemic, and they disclosed that there were minor conflicts among them regarding negative attitude and behavior towards work and their duties, which they attributed to overstress and excessive workload. Next, we have the team 8, emotion focused coping. This is how they cope with the challenges they have encountered during the pandemic. So, results of the interview showed that participants utilized varied coping strategies to address the challenges they encountered and having to cope with the struggles while at the same time dealing with the pandemic is indeed a challenging thing to do. So, getting emotional support is an important coping mechanism for RHU midwives for them to be reminded that they are not alone and that they have other people behind them to offer help when needed. So after the interview, 5 out of 7 participants stated that they are getting their emotional support from their family. It was found that focusing at work helps them to push through the day and cope with the challenges they have faced. And after the tour interview with the participants, they expressed one of their coping strategies also is to binge eating on rest days. So they express that chatting is one of their coping mechanism at work. So next we have the team 9 formulated the spiritual retreat. So results of the interview revealed that during the pandemic and stress encountered by the participants, they cope by using their faith and prayers to cope with the challenges they have encountered. Next is the Team 10, the self-preservation and optimism. So, results of the interview revealed that noble response of the participants on how they cope with the challenges they encounter during pandemic. It includes the positive attitude, self-motivation, and importance on Call of Duty, which urged the participants to do their part. So we have 4 participants who said that and who claimed that they cope by the stress by thinking their responsibilities at work. So they also claim that having positive attitude at everything they faced helped them to cope with the stress. So another strategy they used to cope with the challenges they encountered includes the self-motivation and determination to cope with everyday struggles. Okay, so next we have the team 11, the healthy relationship with the patient, which is the additional information shared by the participants in addressing and solving the challenges during the COVID-19 pandemic. So we have here 1, 2, 3 participants who claim that being compassionate helped them address and solve the challenges they faced during pandemic. Next, we have the proper and careful planning. 4 out of 7 participants claim that family planning services should be given priority by the government, especially during health crises. They also stated that, and they believe that family planning is a life-saving intervention and there is a need to protect the service in order to avoid increased morbidity and mortality resulting from unintended pregnancies and COVID-19 infection. They also stated that the government should have the proper procurement and logistics of the supplies before the pandemic happened. So now let's proceed to the summary, conclusions, and recommendations. This section discusses the summary of findings, the conclusions derived from the findings, and the recommendations offered based on the significant findings and conclusions of the study. So the study was undertaken to examine the challenges and coping strategies of rural health midwives in the delivery of family planning services in selected communities and in Cavite. A descriptive research design utilizing qualitative methodology was used to address the research questions raised in this study. Participants of the study were 7 rural health midwives employed at Indang RHU in 2021. And all of the participants were female with varied ages ranging from 27 to 53 years old. 4 of the 7 participants were single and the remaining 3 were married. 2 participants had a length of midwifery practice for 2 years. 2 participants each had been in practice for 10 years, 16 years, and 30 years respectively. 2 participants had been working as midwife in RHU Indang for 2 years. 2 participants each had been in RHU Indang for 4 years, 5 years, and 6 years respectively. Participants were primarily responsible in the delivery of family planning services to the communities such as first, the immunization of infants and children under the DOH expanded program on immunization, the delivery of family planning methods, maternal and child health services such as the prenatal and postpartum checkups, conduction of nutrition education to mothers and infants, monitoring the growth and development of 0 to 71 months old children, and other services that promote healthy lifestyle and provision of health, education, and counseling programs to clients. Next, we have our conclusions. The findings of the study revealed midwives of Indang RHU are generally female that graduated of diploma in midwifery with varied ages and years of service at Indang RHU. Their primary responsibilities include the delivery of family planning services to the communities. However, during the COVID-19 pandemic, they did not only provide family planning services to the communities, but were also deployed to respond to the virus, such as administering the vaccines to Indang residents, monitoring their vital signs, handling COVID-19 patients, and caring for those who are sick. So, based on the significant findings of the study, it can be inferred that midwives in Indang have faced many challenges, particularly during the period of COVID-19 pandemic. These major challenges include the constant fear of infection from COVID-19 for them and for their families, shortage of staff, heavy workload, shortage of FP commodities and supplies, discrimination from community, and the conflict with peers. These challenges were bravely faced by the midwives during the pandemic, who were not only providing family planning services to communities, but were also deployed as frontline responders during the pandemic. In sum, the participants' faith in God, their compassion, anchored with high sense of duty, positive disposition in life, and love for their family has empowered them to overcome the struggle they went through the COVID-19 pandemic. So, in the light of these findings and conclusions of this study, we have the following recommendations to propose. First is to address the shortage of family planning commodities and supplies in times of health crisis or pandemic. The local government, suppliers, and other agencies involved in the supply chain should give priority to timely and adequate supply of the family planning commodities and supplies in rural health units so that shortage will be avoided and local residents will not be required to buy using their own money. Second is to hire additional staff either as on-call, volunteers, or through job orders should be or may be considered by our Indang RHU during times of crisis so that midwives will not be burdened with heavy workload which could compromise their health, well-being, and performance. Third is to implement stress management and wellness programs by Indang RHU, which can be an important resource to promote the health and well-being of health workers, particularly the midwives, since coping mechanisms have a great influence on how midwives handle the challenges, especially during health crises. Fourth is to engage communication openly with coworkers and supervisors about the factors that cause them much stress at the workplace and work together to identify the solutions. So, a more comprehensive research is suggested utilizing both qualitative and quantitative methodologies is recommended to provide more in-depth understanding of the challenges and coping strategies of rural health midwives. It is also suggested to broaden this research to wider geographic locations covering other RHUs in the province of Cavite to enhance the generalizations of the study. Future researchers should also focus further attention on the major source of stressors of midwives so that targeted intervention can be implemented. Also, to conduct additional studies about the life of midwives in this pandemic or the crisis, to present the output to the Indang RHU, to present this research paper to the Department of Health, and to invite future researchers to find the gap for the next studies. So we have here our appendices, the informed consent form, the ethics review board certificate with the interview guide that we used, and this is the coding that we have used in extracting the themes that we concluded in our study. This is the form 1, 2, 3, and 4, and our references. So that concludes our paper. Thank you very much for listening.